So this is my organization, Dr. Rajiv's New Life Integrative Wellness Institute. Yeah. And in which I am teaching various things which I'm going to talk about, and really thanking each one of you for being here. Yeah, it's a great pleasure having you all, and it always makes my day when I'm in front of people and talk. Yeah, so that's how it is, and I'm full twinkle-eyed always. Yeah. So this is some of the work that I do, or I am an integrative wellness therapist and a new life educator, and I integrate a lot of various modalities, which I'm also teaching now. I am a homeopathic physician for last 25 years, practicing as a homeopathy even now, and a new life educator. What I do is that how do I simplify lives? How do I simplify work? How do I simplify therapeutic modalities? That's my key intention. And I bring in various modalities of therapies and integrate them to treat any kind of disease. And that is where I have found something that has been what I call as accelerated cures or accelerated healings, which is happening where the cures have become very fast and also very effective. And most of the clients, by the end of the session, they say we are feeling great about the way we came and the way we are moving out is like completely different. And not only that, I also train them through the therapies. I also train them in uh, becoming quite mindful about what's happening. And that is what I think we got to be doing as therapists. Like, how do we help people not just um, heal them, but they also become mindful about their own life. They become aware of what's happening, and thus the healing can take place on its own. And I'll tell you why it is so important to be aware. And that is my key area of interest and key area of teaching. Yeah. And I'm a counselor and a health psychologist, and also a relationship wellness counselor. I have lots of couples coming in, or uh, uh, single persons coming in, but at the same time who are in relationship, and they can find that they're able to crack the code of a relationship, or they're able to bring about a healthy shift in their relationship with ease. Yeah, there's a lot of healthy understanding. That is what I am looking for, not just uh, clearing up relationships so that they go back home and that's not, but they develop an understanding about what a healthy relationship is, and that is from their own perspective, and how they can maintain that level of health and harmony in their relationship. That is the key. And of course, I am also a core somatic integration developer. I have developed my own therapy called core somatic integration, which is where I am teaching all this, and I'm going to give you an insight about that, like what actually happens. And that is where people have been able to who have been learning these therapies have been able to accelerate cures more than 50-60%, more than 60% or something. They have been able to accelerate cures and make a big shift in the way they relate to the clients, at the same time bringing about healing. And people who have just been attending sessions, maybe the first workshop also, they say that they have been able to do a great work with their clients, the clients with whom they were not able to bring about a shift.
पाइनएप्पल लाया है, कैसे खाने का वो बताओ, धो के इसमें
how they have been able to heal. So that is what we are going to learn a bit on this. Yeah, and also you get an opportunity. If you are interested, you can always join the workshop. It's going to happen soon. So it is it's a choice. Yeah, definitely something that is very effective, rapid, safe, and it brings about a develops a big, healthy, mindful awareness. Yep, this is what it is. So let's go ahead. Oh, there are a lot of people joining in. Okay, so for those who wish to evolve at every point in space and time, these are some modalities that I talk about. We offer a combination of most powerful therapeutic and self-evolution modalities for lasting change The one I have developed is core somatic integration therapy, clinical hypnotherapy, transactional analysis, or core somatic integration is my own founded therapy. And then I'm also a trainer for clinical hypnotherapy, transactional analysis, neuro-linguistic. I work specifically with creating happy relationships. I have also been training myself in Tai Chi and Qigong for the last 20 years, have trained few people. And that is what the understanding of Tai Chi and Qigong is what I bring about in my work. And creative visualization, conscious breathing modalities. Mindfulness is one big thing, as I said. So that is what I do. Yeah. So the secret to healing any disease. It's an introductory webinar. Yeah. So now let's try to understand what it is. Yeah. And I'm quite sure there could be a lot of people who are practicing, who are training, who are therapists, who are counselors, who are physiotherapists or doctors, yeah, who are in the healing field or the paramedical field. Yeah. And this is very helpful for anyone and everyone because you can start to heal yourself or also complement this work to with whatever therapies you have, therapeutic modalities you have to heal others. So that is how it works. And one of the things that I always tell people or I encourage them is to work on their own healing as therapists or healers so that you can start making a big shift in people. Remember one thing, your healing is as good as much as the kind of work that you are doing on yourself and almost equivalent to the kind of healing that you do of your own self. That is what is very important. So a constant work, it's like a constant dynamics between you and your client, between you and your family members, between you and your spouse. That's as much as you heal, that much the relationship heals, that much the client heals. So that is what it. So if at all anywhere you start getting stuck in your family, in your relationships, in your with your client, get that you got to up the measure first. And you will automatically see that people are moving in your zone. And that is one thing that I've learned in my practice for the last 15, 20 years as a therapist, as a healer. Now, introduction to learn 6 steps technique to heal any disease. Initiate cellular healing in minutes. 4 steps to reverse programming to natural immunity and health and prevent incurable disease. And the question mark is because I do not believe that there's anything incurable. Yes, what can be said is that the cure has not been found by current medical standards. That also the conventional medical standards. Yeah, but otherwise, cure is possible. Only thing we got to rise. It's not that the rockets were not there. It just took us time. Or it is not that the electric cars were not there. Yes, but it just took us time to develop our technology to a level where we can have electric cars or we can have rockets. Yeah. So we got to develop ourselves. Same way, the cures that were the diseases that were supposed to be incurable. And again, I'm telling, according to the conventional medical standards, because they are looking only at the physical body and they're looking at parts. And that's why this and they have the cause and effect story by which they say, oh, this is the cause is not there, so we can't find a cure. That's not true. Yeah. So I want to first break down that belief, if at all people are carrying that there are incurable diseases. Yes, if don't have that kind of time in order to heal the disease, that's possible. Like if someone is coming in the last stage of cancer or something, we don't have so much time, or the energy levels of the person, the immunity of the person is not so high to heal. Yeah, but diseases are not incurable. We got to raise our standards, and that is where when I started working with people, I came up with this very scientific, rapid and effective therapeutic modality called core somatic integration. That is what I have developed. And I started seeing a huge change happening in people at a very rapid rate. And even if it is moving at its own pace, people start feeling a sense of calmness, a sense of peace, and they can feel that it's permeating in people around them with these. They are having a different viewpoint about the whole, about the people around them, about the world. And that is what is very, very important to heal. Yeah, we're going to talk about that. And I just want everyone to just close your eyes for a moment and just observe your body for some time. Just close your eyes for some time. This is the only meditation we are going to do. Pay attention to your breath at your nostrils. And feel the breath going out of your nostrils. Be aware of the sensations at the nostrils. And just notice how the breath goes in and comes out, and slowly start looking at the variety of body sensations that you have. Breathe in deep and breathe out. And slowly open your eyes. And I'm not going to take any feedback because that is really going to take us time, yeah. But at the same time, this is just the beginning. Like we are touching the surface of how we go about it. We're just touching the surface. So you might be connecting to some of the things that you must have done with body work or mindfulness and all that, yeah. So that's where we begin, but it's completely different than what you already know. So going ahead with this, how long does a human being live on an average? Yeah. So you might say, okay, 60 to 80 years or even more. How is it possible? The reason is we are able to live that. So just imagine what is the body doing at that time? Like, how is it possible that we live for 60 to 80 years? Or maybe there are people who are living 100 and there are people who are living 100, 115, 120. So how is it possible? So there's something that the body is doing that is able to maintain this standard of keeping us alive for such a long time, especially given the kind of situations that we are in, given the kind of habits we have, the lifestyles we have, the life-threatening situations that we go through, the environmental changes that happen, accidents that we meet. But still, how is that possible? And that is happening because of our own beautiful, powerful, autonomous, innate healing system. And the healing system is autonomous and always in integrity. The way you are, that's how the healing system will be. And that is where we have to start getting present to the power of the healing system. At the same time, how can we cooperate with the healing system to have ourselves heal any kind of disease, or the best thing is to prevent the disease from happening. Yes, it's very much possible that you can prevent the disease. That's always better than treating the disease. Yeah, but of course, for people, it may not be very helpful. For the pharmaceutical giants and all that, it's not a great news. Yeah, because people start preventing diseases or not getting disease, that's not going to work for their business. Yeah, but then that's how it is. We can always work towards it. And the healing system restores order, balance to help you reclaim your natural state of health. So let's first understand natural state of health. So just imagine I'm going to give you a photo now. So this is what it is. Why we should not believe that this is not going to happen? We got to believe that the body is capable of healing. Why? So just imagine you get fractured, or you have a bruise, or you have a cut. Do you do anything to actually heal it? No, you just put a plaster on the fracture and you leave it there. Yes, you may say, I'm taking medicines. Remember, the antibiotics and all are not taken to heal. They are not taken to heal. They are taken to prevent any kind of abscesses forming, yeah, or any kind of infection to happen. But the healing always happens on its own. It's an innate mechanism. Yeah. And also look at this, look at the kind of, we talk about cuts, bruises, they all happen on their own. We don't have to do much. All of us as kids have fallen down, have bruised our knees, for sure, at least once. Fallen down from our cycles. People have broken their hairs, broken their bones, or twisted their ankles. But somehow, if you just rest it out, after some time, it just starts falling in place and you start healing. Yes, you need to assist. You need to assist the healing. If you got sprained, then you got to rest. If you are fractured, you don't touch it, move it so much that it produces a strain. You should not be doing that. So something like you support the healing system. That is what is very important. If you are not supporting, then there is the disease. Now remember, the Vedas also say that the inner intelligence of the body is the ultimate and supreme genius in nature. The body is highly intelligent, super intelligent. It just knows how to function, and it works in harmony for all the 80, 100 years that you're alive. It works in harmony. All the systems, there are so many systems, the respiratory system, the circulatory system, the nervous system, the skeletal system, the skin, and everything, the urogenital system, they all work in tandem. They all work in tandem. The immune system. Remember, the immune system and the healing system are different. Immune is basically fighting the infections. But there is an innate healing system which connects to all this. And when all of them are working in order, the healing system is working at its best. Each of us have this extraordinary gift, a body that knows how to heal itself. Remember, a body that knows how to heal itself. Even if you don't do anything, it will start healing itself, like the cuts and the fractures. Yeah. Yes, you got to assist it. Now, Dr. Brownstein, I'll talk about this. And I'll just go back a bit in history, and most of us have heard of Norman Cousins, the author of Anatomy of an Illness, one of the books that he's written, and he's written other books also. And he was suffering from, he was born in 1915, and 1915, and he was suffering from some heart disease. He was diagnosed of it, and then collagen disease, and then a connective tissue disorder, and ankylosing spondylitis. And these were all incurable diseases. And they said that, okay, you got to live with it. And they had given just few years to live. But this person, he understood the connection between the mind, emotions, and healing. And he also understood the power of positivity, optimism. And he started watching and the effects of emotions on the body. And he started watching all these comedy serials. And he would laugh. And every day, 10 minutes, he would laugh. And he was just on some diet of vitamins and certain healthy diet. And over a period of time, he not only surpassed that time period that the doctors had given, but he started becoming healthier. So that is the effect. So he said, he talks about how medicines are not required. Dr. Brownstein, this is one of the books that I've read, and I was really amazed. He said he had one of his patients who actually had to undergo some operation of the lung, but since the surgeons couldn't get through to the lung directly, they had to remove one rib. And when they removed it, and after many years, when this guy again had to get X-ray, he saw that the whole rib had grown again. May not be of the same standard, but it had grown again. So the doctor actually took the copy of the X-ray and kept it with him. And he started understanding what this healing is all about. And he's one of those who believes in this, and he's an MD. And he's believing and he's practicing the holistic therapies. Miracle Man, you know about Miracle Man, the Maurice Goodman, who met with an aircraft accident. And doctors predicted death. You have to see this film. The doctors predicted death immediately, that he's not going to live for more than a few hours, because every bone in his body had broken. His lungs, the ribs had pierced in his lungs, and everything, his urinary bladder, everything was like wounded. And the doctor said he's just going to die, and even if he lives, which he did for the next overnight. So the doctor said, even if he lives, he'll be a vegetable. But this guy said, no, I'm going to walk out of the hospital on the day of Christmas. And within 6 months, he walks out of the hospital. And there he shows that what is the power of the mind. And the power of the mind and the healing system is very, very much connected. One of the reasons we are not healing ourselves because we are not using the power of the mind. We have given the control of our power of healing to outside forces like the medicines. And we are told that if you don't take medicines, you will suffer. But if you notice, even after you take the medicines for 10 years, you're still on medications. 20 years, you're still, and the medications increase in most of the cases. If not, some other disease develops and you're taking some other medicines. And this goes on and on. And you're also told that you have to be on it lifelong. Now, if you have to be on some medications or some external force lifelong, like a crutch, then you have to question, is it healed? Is it cure? Or is it just sustenance? Right? Like it's almost like the wall or the building is falling and you put a crutch over there just to keep the building. The building is not standing on its own foundation. So, but at the same time, I also said that the power that your body has to heal itself, you can provoke it, you can bring it up and start healing yourself. But there are a few things that we got to do, and they are very simple. That's what I've learned over a period of time. Yeah, I will be talking about few people of my own clients, like Swati. We just did a workshop just now, and Swati, who was having severe pain in her neck for last 3 years, and in 20 minutes, and there are some people who have seen this, in 20 minutes, the whole pain just vanished. And it's been 1 month. I've just spoken to her yesterday, and today she sent a message also saying that the pain has not come back. Another lady who was suffering of an ankylosing spondylitis, yeah, she's staying abroad, and when she came on the Zoom session, she was having severe backache. And she says, I cannot even walk. I was holding the walls and walking in the morning, and I thought I had to cancel the appointment. But she somehow came in for the appointment at 3 o'clock in the afternoon. And at 4 o'clock, she's saying there is no pain at all in my body. Yeah, so Varsha writes, I am a witness to Swati's case in workshop. Varsha, I would have you to talk after some time.
Thank you. Sure.
And Shehnaz, who's again not there, some of them who are from South Africa, they would be knowing her. And she had this acute tennis elbow. She was also attending the workshop. Severe acute tennis elbow, severe pain. And in 30 to 40 minutes, there was this pain which had come down by 98%. In second day, it had gone down to 0%. There was this girl who was suffering of PCOD. This is long time back. And she's a psychologist herself, and she came to me with PCOD, and she said, I'm not at all interested in any relationship. I'm very sure I'm not going to get married, and I don't want to. And we started the work. PCOD is some place where I've got brilliant results. Let me tell you, polycystic ovarian disease and many female disorders, I've got brilliant results, migraines and all that. And PCOD, and which keep me taking medicines, and then they put on weight, and then they have their own hormonal problems, and maybe some other procedures are told to them, and other complications. And this girl, we start working. She was 22 at that time, 21 or 22 at that time. I started working with her. We just did 3 sessions of 1 hour each. And in the second session, she says, I don't know, but my relationship with my mother has started changing, because I would always get into arguments and fights with her, but I started becoming very calm with her. And I seem to be getting interested in guys. In the third session, she says, I think I'm going to say yes to a guy. And after that, I attended her marriage, and she's a mother of twins. Now they are staying abroad. And another person who was suffering from leukemia is no more. But at the same time, when he came in, his situation, which was so horrible that he couldn't even stand up properly, he was completely tired. And like whatever happens in a disease like leukemia, cancers and all that. But within 4 to 5 sessions, he drove his car 50 kilometers in a day on his own. And he was a CA, and he would not attend his the office for last 3 to 4 years since he was diagnosed of this. And after he came in for the sessions, he said, I'm never going to practice the CA again, or whatever he was doing. He says, I will do what I really want to do, and I want to play music. And I was always good at music, and he was playing some strange instrument, very unique instrument. And he says, only 6 or 7 people in this world know this instrument. And he went ahead, practiced it. In next 4 months, he did a concert in Pune for 3 to 4 hours. And it's not a joke to do a concert, because it needs a lot of attention, lot of practice. And this is how it is. And of course, I'm not talking about the last one, David. I'm not talking about the therapy that I'm doing, but I'm talking about holistic, where I was doing homeopathy with this person. Universal, alopecia universalis means every hair in your body, right from the top of the head to the bottom of the feet, every hair you start losing and you become bald right from top of the head to the bottom of the feet. And this person I had given homeopathic, and I still remember it was just 1 dose. And within 3 to 4 months, he had hair coming back on his head and his chest and his beard and everywhere. And this had come in one of the very prestigious journals in homeopathy, which is supposed to be an incurable disease. I'm just talking about the power of holistic therapies. When you are triggering off the healing mechanism in the right manner, it can cure any disease. And this is just one of cases that I have, like some of cases, like I know my colleagues and all, they also have so many cases to talk about. So just let's understand a bit on psychoneuroimmunology, this healing system. PNEI, psycho-neuro-endocrino-immunological system. So basically, we are all a unit. So it is not that there's a separate healing system and that is separate. No, it's almost like the various rooms in your house, the front room, the living room, the kitchen, and the bedroom, the washroom, and they all come together to make a house, to make a home. Same way, our whole body works in tandem with each other, right? And any place, anything is not in place, it will start impacting the other parts of the body. But what is the main thing that is impacting the body is some kind of stressor. Something that provokes or affects the body with stress. Now, stress is not abnormal, friends. Stress is normal. Stress is not abnormal the way it is. Like I have a lot of people telling the doctors, even saying that, oh, you're stressed, don't get stressed. Remember, stress is normal. You're able to sit or you're able to lift your hand, you're able to lift your leg because of some amount of stress in the muscles, in the joints. Otherwise, if you're not stressed, you're almost like a paralyzed dead body. So stress is not bad. Yes, if you cannot handle the stress, it goes beyond the capacity to handle, then it is actually going to impact your body and your mind. And when it impacts your mind, then you have some kind of psychological issues, anxiety, depression, insomnia. Yeah. Now remember one thing, when we talk about, most of the clients, they come to me and they say, oh, but I found that it's on the hormones. The hormones are creating the problem. Remember one thing, friends, the hormones come much later. Before that, is impacted. Before that, the system is impacted. Are you getting me? So, and I also tell people that you got to remember, it is the invisible that is controlling the visible. It is the invisible that is controlling the visible. And the visible reciprocates to the invisible. So there's something that is invisible. That is what the conventional medicine or the research will not be able to find, because what's not there, how can you find it? But it is impacting. Like, just for an example, you cannot see the love of your parent or your friend, but you can feel it. Behaviors can be there, but you cannot see it. You cannot record it on video, but you can see the behaviors. Same way, you can see visible symptoms or health. The person is able to walk up the stairs, run and all that, and be happy, chirpy, but you cannot see the invisible thing that is behind them. And that's how the healing system is. So, and it's innate, it's inbuilt. And when that is hampered, it starts expressing itself as a disease, not to hurt you, not to tell you that you're wrong. It is just trying to bring your attention to itself, saying that you pay attention, I will set it to harmony and health. I will set it flowing again. I will start making it easy. But most of us, instead of paying attention, we take the help of certain medications and never allowing the healing power to come up. And that is where we are falling short. And this is not because we don't want to do it. It is only because it's infused in our minds that you're not supposed to take risk with your health. You got to take medicines. And that's also true. When you allow, it starts falling in place. The body can heal itself. But you've got to develop or train yourself to understand that and pay attention to your body in a way such that it heals itself. So all this is also getting impacted, the nervous system, the immune system, and the endocrinal system. And when any of this, the healing system is not in place because of the stressors, then it starts producing its impact on any of the systems. And one system gets affected. If you see, the arrow is both sides. The blue arrow is going nervous system to immune system and back, both the sides. So it doesn't matter which system gets affected. All of them are going to slowly get affected. But what, as one of the doctors says, like I think it's Bernie Siegel. Yeah, let me check. Okay, so before that, let me look at this picture. You can see there's a mountain and there's so many roads, the winding roads around the mountain. So I put it as this mountain is the basic health, the natural health. And the roads are winding, and this is exactly how it goes. There's so many things happening in our body going up and down like a sea wave. There's no sea wave that is constant. Some comes from here, some comes from, and if you want to be a great surfer, you got to play around with those waves. And the surfer is with the wave rather than against the wave. And same way, we got to be with what's happening in the body rather than go against it or suppress it. Its functioning, its expression. But since we are not trained, we generally go for the easy way out. And what we do is do something or take something to suppress it or ignore it. Remember, the signals are only going to get louder. You start with the headache and slowly you just keep pushing in medicines, and after some time you got high blood pressure. You keep suppressing it and you ignore it because you're so busy making money, or you say, I don't have time for all this, and you're not taking care of your health. And then one day you develop some heart problem, some cholesterol and some heart attack and whatever. And then you say, oh, this is natural progression. Yes, it's a natural progression because you didn't pay attention. But that's not. The natural progression is always towards health. Health is the fundamental principle of you being a human being. It's the fundamental principle, like the mountain around which the winding roads are there, and you are nothing else but the car, the driver in the car, and you are going to drive the car like as on the road which is winding around the health. So your job is to take your car around, so that asks for. So the mountain is the fundamental principle, and the car on the road is body, which is organizing and balancing and adjusting and adapting, and it's very resilient. And the driver is you. And that is where you got to be willing, responsible, and committed to your own health. You got to have the willingness, responsibility, and commitment. And that is where I have seen my clients also, people who are willing and who are ready to be responsible and who are committed, they move faster than the other people. And many of them who are not willing, who have been pushed into the therapy and all that, and who are saying, oh, this is too tough, I don't want to do this, I don't want to confront I see that either they fall out of therapy or they take a longer time. But the moment they become aware of it, they just move like this very quickly. Your body also displays an inner intelligence. Health is natural. Remember, disease is temporary. Health is natural and normal. Disease is temporary and unnatural. When you are in health, you feel at ease, you feel light, and you feel comfortable. And disease, you feel uncomfortable, you feel unease. Prince, be careful. Everything is energy. Ancient wisdom with neuroscience, which neuroscience and epigenetics research is proving this now. Remember, it's ancient wisdom. It was already there in India. It was already there in China. It's already there in Japan, Egypt. Everywhere, this was always available in the ancient scriptures, shamanism. And now neuroscience and epigenetics is proving that. And they're also coming up with the research on lifestyle changes causing diseases and health. And they also found that mindfulness, exercises, sleep, rest, good food causes health changes. That's why many of them are falling sick or getting depressed, anxious. Today also I had someone who was just anxious, 20-year-old, severely anxious, panic attacks. And when I asked him, what time do you sleep? He said at 3 o'clock. If you are not sleeping, let me tell you, anxiety is the first thing that you're going to suffer from. Sleep is very important. You cut down on your sleep, you're cutting down on your life or the joy of life. You will exist, you will continue to live. Yeah, but then you have to think. There are two important techniques, and we are going to move quickly into what I actually intend to talk about. Two important techniques. One is called attention and another is called intention. And this is what I'm teaching in my workshops. This is what I teach people. This is what I tell people. How do we go about in life? First is attention and second is intention. Attention is you're paying attention to what is happening and how it's happening rather than why it's happening. Most of the people keep asking these questions. Why did it happen to me? Why is it that I am suffering? Why? It's very simple. You take water bowl and you put red color. You will never get blue color, blue water. You will always get red water. You take blue and put it in that, you'll get blue water. So it's quite simple. There's something that you've been doing or not doing, because of which you have reached the position that you have reached. But instead of asking the question, why, ask the question, what is happening to me, how it's happening. Doesn't matter whether it's a relationship, doesn't matter whether it's a disease. What is happening and how it's happening. What is happening is, how is my body presenting the problem? What is happening in my relationship? What is the breakdown that is happening? And then you will start knowing what is the breakdown and slowly go into the root cause of it. What happened? What happened? Why it's happening? It puts you in a victim mode, first of all, and it only gives you excuses and reasons to blame someone, others, or self, or the environment. And blaming never works. It only worsens the situations and the disease. It never leads you to health. Look at most of the marriages. They are breaking down because people are saying, why it's happening? Why this person is like this? Why the person can't change? Why? Why me? And just equate it, bring it down to health. Why should I suffer? Why not? Because you must have definitely done something which you're not intentional, but you have definitely done something. Why? What and how? And it's all there in the body processes. That is what I teach. And then intention to heal. You've got to have an intention to heal. Remember, disease is created unconsciously. We are unconscious creators. We create patterns, breakdowns in relationships very unconsciously, because they're all past patterns that come up and we start developing the disease in a relationship, disease in health. But to heal it, we got to be conscious co-creators. We are unconscious creators. We got to be conscious co-creators. Co-create, we got to assist the body or the energies that are within and around us to help the body heal itself. And that is where the intention is very, very important. We got to be conscious co-creators. Now, I just quickly go into the 4 universal laws. The 4 universal laws which are intangible and they are constant. One is the law of cause and effect. You definitely have done something where you have the disease or the health. Vibration, everything works at the level of thought. Intentional creation. You got everything works on your intent. We talk about the thought and law of attraction. Everything works on your intent. So you're intentionally creating only thing you may not be aware of it. So that's why when you actually start working at the therapeutic level, I ask them, okay, what could be there behind it that has created it? And most of the people don't know, but then suddenly they become aware. They say, oh, I can now see what's happening, why I did it. And it could go back down in childhood or teenage, or it could be in your mother's womb, or it could come from somewhere which you're not even aware of. Some people call it past lives, doesn't matter the name, but it's coming from somewhere which is there in your memory bank, which is having its own impact on your mind and body. And the 4th is called allowing, which I call as the witness sensing. You're witnessing what you're sensing. And that is what is the reality, listening to body communication. These are the 4 laws. There are many of them. There are 15, 13 different people have different, but I've just picked up these 4 laws which we can use for healing. The cause and effect, the vibration, the intentional creation, and allowing. It's very important, allowing, witness sensing. And that's what I teach in my workshop. How do you, I told you, it's all about being mindful, being mindfully aware to heal yourself. And I have seen that people can heal themselves of any disease. And it has also been found, if you're going through a therapeutic modality, you might take more time. This will bring down the time period. Very quickly, people start realizing how to bring about a shift. And what's in the unconscious? Emotions and memories. So this is some of the things that I've taken. So if you notice the effect of anger, fear, disgust, this is there on the net. You can check physiological changes connected with emotions. So it can impact. And if you look at happiness, it's bright and yellow. And if you look at love, it's bright yellow. So and rest of them, they are very dark. So that is the impact of your emotions. So that is why it is very, very important to have healthy emotions, positive emotions. It is very, very important to have healthy emotions, positive emotions. Now, the positive emotions cannot just come by thinking, oh, I am positive, I am happy, I am joyful. And then the person comes back and say, oh, but I keep telling myself I'm happy, joyful. But what is the deeper emotion? Like I had a person recently saying, but I keep chanting, I'm happy, and but it doesn't work. That's because the deeper foundational emotion was of sadness, of anger, of resentment. Until the time you don't heal the sadness, resentment, uh, and fear, you cannot just keep narrating or saying or chant or do affirmations. It may not work, or it will take a longer period because you're going completely against what the subconscious is trying to express. The subconscious is trying to express unhappiness, sadness, fear, and you're saying, I'm happy, I'm happy. It is not. Remember, the subconscious is 6,000 times to 30,000 times more powerful than the conscious mind. It's like a tsunami when it comes in. And that's why you cannot just, like the people say, oh, I'm so depressed, I'm so anxious, I'm so worried, and things are not working, my business is not working. Whatever I try, it's only going, it's falling flat on its face. Then you have to know that the subconscious is trying to tell you something. I'm working on my relationship. I always think positive. I wake up in the morning. I'm saying, okay, today is going to be a great day. I'm going to have a great time with my family members, with my spouse. But the moment I open my eyes and look at my spouse, I say, oh God, I don't want to live with this person. Now what's happening? You got to be clear that there is some indication that is being given, because there are deeper emotions. There are a lot of people who are my clients over here. They can vouch for this, that how it transforms the way the changes, how it happens. The secret of any healing of any disease is, I'm going to take questions after this. Healing your emotions and witness sensing. Basically, it's witness sensing to heal your emotions. I was myself suffering from a major disease for many years. I had irritable bowel syndrome. I was in anxiety for 10 to 12 years, severe depression for a long time. And the whole work I started developing when I was in 2004 or something. I could not find a breakthrough. My business had gone down. I was just feeling very low. Used to wake up at nights, and from 2:30 to 4:30, I would keep crying. And this went on for almost 3 years. I kept crying, and I would not know why I'm crying. And that is the time I would sit down with myself and observe what's happening. And over a period of time, I started seeing that as I developed this habit of sitting down with myself, I noticed that there was a switch happening inside me. And slowly the whole attitude changed. And I was much more easy with myself. And slowly and steadily, I started developing this idea that how does it happen? I started writing it down. And by 2010, in 6-7 years, I had some idea as to what is happening. By 2013, I think I gave my first workshop. I did seminars internationally and published my papers, which also won the best paper award in Dubai when I presented it to the psychological center over there at Al Rashid. So this is just very briefly I'm telling, and that is where I started. I developed this whole therapy. They're not going here. So there's, see, Dr. Bernie Siegel, he writes, there is no such thing as an incurable disease, only incurable people. And that is why you got to, and that's why holistic therapy is very, very important. And that is the secret of healing anything. And that is done through witness sensing. And I call it that there's nothing like, when you say incurable, I say it's incurable, within the curable standards. That is how I see it. There are no incurable diseases, only those for which man has not yet found the cures. Remember, the body heals itself. What we need to learn is how to communicate to the body to heal itself. And to heal, core somatic integration, that is the name of the therapy, and unfreeze feelings and trauma. Because whenever you are traumatized, what happens is that the feelings, we are born as life essence. This is the life essence. We are all born with life essence. And It is expressed in the form of feelings. But whenever we are traumatized, these feelings get frozen. These feelings get frozen. These feelings get frozen. Yeah. And then the nervous system holds on to that frozen experiences. And then it gives symptoms in the form of abdominal pains, migraines, PCODs, leukemia, or colds, eye problems, ear problems, anything and everything. And then we are not healing them, we are suppressing it then with medicines. What you got to do is that reconnect to the body's healing system by the process called the witness sensing, which is like the, and then unfreeze those feelings, and that is where unfreeze those traumas, and then release the stress in the nervous system and reconnect to the life essence, and that's where healing happens. And that's where in minutes, in 15 minutes, 20 minutes, you'll find the healing happen. So I'll just take some questions here, and then I'll tell you about the steps over here. Okay, anyone who wants to ask questions, go ahead. Yeah. Wait, I'll just stop the share. Please go on mute here. Yeah, Chaudhary, please go on mute. Please stay on mute. Yeah, first I'll take Neeta. Neeta was the one who was asking question, and then I'll take Hither Foundation. Hither Foundation.
It was by mistake. I was doing something and it was by mistake. So
Okay. Please go on mute. Hither Foundation.
Dr. Rajiv, I had sent you one question on the chat. I think it has come to you. If you can check this, there was one question I had said maybe you could touch upon the autoimmune disorders.
So ask me.
So okay. So I thought because you were talking about the body's self-healing properties. So how do we understand autoimmune disease or autoimmune disorders where the body itself is very naturally attacking itself, and how do we understand it in terms of where does it stand vis-a-vis the self-healing?
So basically, when would a body attack itself? Right? See, we are all made up of energies. We are all made up of emotions, thought, feeling, emotions, energies, and then the body or the behaviors. Now, when you are holding on, it's almost like you're holding a knife. And when you press the knife, what happens is the person who gets hurt is yourself first. And that is exactly how an autoimmune disorder works. So your emotions, which you are not able to manage or control or handle, or the emotions, the negative emotions, so-called negative, there are no negative emotions, but something which beyond, like anger is good, but if you're holding it beyond a particular level or a particular intensity or resentment or hatred or fear, after a particular point, it's almost like the other side opens up. That is the negativity side. And now the first person who gets hurt is yourself, because you are holding on to that emotion. So you are going against yourself. And that is what we call as autoimmune. Right? And what is the best way of, like, it's your house, you have kept dirty, you're going to feel the smell. I'm just giving it in a way where you start understanding it. So you got to clean up those emotions first. Clean up that experiences first, those memories first. And if it's an autoimmune disorder, then it's a deep issue that you got to, deep intensity issue, which you got to deal with. Are we together? Does that make sense, Nandini? Yeah, it's basically
Absolutely, sir.
You going against yourself. And it's all the play of emotions which you have not dealt with in the most healthy manner. And only reason is that you don't know how to deal with it. That is the only reason. It's not that you can't get trained. That's why even autoimmune disorders can be healed. Right? Can be. Yeah. Only thing we give time.
Dr. Rajiv.
Dr.
Yes.
Rajiv,
Yes. Who's this?
Thank you so much for the talk today. I've really enjoyed it.
Yes. What's your
I
name?
my name is Heather Fountain, as in water fountain.
Yeah. Your name is Heather Fountain. Okay. Okay. I got it.
Yes. Sorry. Thank
see
you
your
very
face?
much for the talk today. I've got a friend who would very much like to interview you in South Africa.
Okay. Great.
So his name is Hendrik Baird, and I'm going to ask somebody if you can please, is your email address somewhere that he can contact you?
Yes. I will ask Shehnaz to put it on the group.
Thank you so much.
Yes, I think.
And I really appreciate it, and I believe everything you've said today, and I'm a hypnotherapist.
Oh,
Thank you
lovely.
so much.
Thank you very much.
Thank you.
Thank you.
Dr. Rajiv,
Yeah.
my name is Nirmala.
Yeah.
Dr. Rajiv, I wanted to understand if this self-healing methodology works for cancer.
Yes.
It does?
Yes.
Something which is a stage 3 cancer?
See, that is what I told. Everything can work, but we have to have the time, and the person also has to be responsible enough for the for their own healing.
Okay.
Yes.
Okay. And Dr. Rajiv, the number which was there in your presentation, is that your own
Yes.
self number?
9820800120. I put it on the group,
Yeah.
on the chat.
That's connects to you directly.
Yeah.
Okay, Dr. Rajiv.
I put it on the chat.
Thank you.
Anyone else?
Yes, I wanted to ask the same question.
Yeah, Kanchan, I'll just. And friends, this is not just about self-healing. This is also about healing others. So people who are into therapies, counselors, I have a lot of counselors and therapists who are doing this work. Yeah. And they have found it to be very, very effective. Very, very. I'll have one or two of them talk about it. Varsha, would you be willing to talk about this?
Thank you so much.
Yes. Okay. So I'll just take first Kanchan. Kanchan, please go ahead.
Yeah, so I was asking the same question. Does it heal to the stage 4 cancer?
No, it cannot. It cannot, because the body immunity has to be there in order to heal. Are you getting me? Because you cannot create. The immunity has to be there. The power has to be there. Persons, and we don't even have the time.
Okay.
Like I have someone who's got 4-stage cancer. I believe it's 4th-stage cancer. She's just going through her investigations, but I believe that it's 4th stage. Yeah, but she also is doing the core somatic work herself. She's saying this is something that I would have been worse if I would have not done it. But now she's only practicing this, and now she's undergoing investigations. And at the same time, I'm not saying that I'm going to tell them not to take the medicines. No, they got to take the medicines, because the life is more important than the therapy. This is what I believe in. It's not about proving my therapy or anyone's therapy. It's about the life of the person. If she gets healed by anything else also, it's perfectly okay. Even if it's allopathic or whatever, she has to get healed. And then we can always try our therapies on. Are we together, Kanchan?
Yes.
So if it's whatever, first things first, the patient first, like in homeopathy, the patient first, then the cure. And that's the principle I follow. It doesn't matter what and which therapy. The person has to be alive in order for the treatment to happen. Yeah, so that's not what I'm saying.
And this therapy is related to some medicines, or as you said, shared in the discussion, it's all based on the neuroscience?
Yes, it's all based on the impacting or enhancing or bringing up the healing mechanism of your body. Right? I am also, I tell them a lot of things. I tell them to put in sometimes breathing exercises or physical exercises. I suggest also yoga, because they're all body related. Yeah. But at the same time, they undergo this therapy, and then whatever. I tell them to do it, because they have to enhance, they have to maintain some kind of discipline and all that. Some lifestyle change is required.
Raji, this is Manisha here. May I speak?
Manisha, please go ahead.
Yes, so my question is, in fact, two questions. The first one is, it is about my niece who's experiencing severe skin eruptions. Now, nobody has been able to diagnose it correctly. First they said eczema, psoriasis. Now they're talking of autoimmune, and she had it when till her 10th standard, severe. Then it just disappeared, and now it's come back again since the lockdown. In fact, she says she's a lot more peaceful now as compared to how she's been throughout her life. But she's like, I'm wondering why it's come out now. Uh, Point is, it's about her, yes, but also skin related issues is something that runs in the family. So something, I also have something similar. My daughters have, my another nephew, niece. So is there some link that is there? And what can be done about my niece? That is my first question. Second question is your course. What is the duration of the course, and how does it go like?
Yeah, so the duration of the course is, it is a 2-day thing, the level 1. Yeah, there are 2 levels currently. And it is from 3 to 8 o'clock, 3 p.m. to 8 p.m. Indian Standard Time. And it's on the 3rd and 4th. That is the next week. Secondly, yes, if there are many people that are getting affected, you've got to see what it is. But of course, if it's autoimmune, basically the person has to be first ready. Instead of trying to find why it is happening, the person will say, because we are going inside the person. There could be some memories, some experiences, some kind of emotions that are getting suppressed because of the skin disease. And generally, skin is generally related to some kind of separation anxiety with the mother. Does that make sense?
Yeah.
Okay, so I think Anu was there. Anu, how to work with fear? See, fear is a basic instinctual response. Fear is a basic instinctual response that we got to respect and acknowledge. It helps us to protect, and it protects us, and it helps us to survive. So there's nothing wrong about being fearful, but if it's beyond a particular limit, then we have to check what made it happen like that. Some kind of instance, some kind of past problem that could have been there.
Yes, I can see something moving, so that
Yeah, that is the body sensing. That is what we are talking about, witness sensing. That is what we use. Like I had this lady who came to me with fear of flying just 4-5 days back, and she's not able to fly. She gets very anxious. I just told her to sit there and observe what's happening. And the moment she sat down and experienced the fear of flying, she started trembling, and she said, "My body is feeling so cold." These are all symptoms of fear. Now remember, the only way to get out of a disease is to go and connect back to the problem. Okay. It is like you want to go out of your house. You can only go out of your house if it's a single door entry. You can only go out of the house the way you came in. There's no other way.
Okay.
Same way, if you're having a disease, the way the disease got in, that's the only way to health. And once we start understanding it, you will actually start knowing that how to feel. And when you are connecting, and we are all taking information through our senses, and then something happens, programming happens in the brain, and then whatever happens, and if there's a breakdown, that is producing as disease. So you have to go back through the sensation method only. That is where witness sensing comes in. You have to reconnect to the sensing method. And that's where the change will happen. Okay?
Yeah, I want you to help me in this, because I want to overcome this. It's not today. It's
you will have to call me up. Anu, you will have to call me up.
I'll do that.
And then, yeah. Thank you. Hari
Thank you so much.
Hari Kirti.
Yes, doctor. Can you hear me?
Yes, I can.
Okay, so this class which is on the 3rd and 4th, is that for people who would like to heal themselves, or is that for healers?
Both.
Okay, and is this the core somatic one which we are talking about?
Yes.
Okay, and that is online?
That's online.
Okay. So if I know a patient who would like to have a treatment, then do we bring her directly to you, or she can consult online?
Both ways.
Okay.
I'm doing most of the work. 50% of my work is still online, and 50% is in person. even during
Okay.
this COVID time. Yeah.
Oh.
So thanks. So Varsha, would you like to
Yes.
share something about the
Yes.
workshop, or you wanted to share? Yeah, please go ahead.
Yeah. Yeah. So, hi everyone. I'm Varsha Punjabi. I'm from Hong Kong. I'm a hypnotherapist, and I have done 2 levels of Dr. Naidu's core somatic integration, and I've had great results with my clients. And I think all of you must try this. This works like magic. It really works like magic. I'm so fascinated by this. I'm so fascinated. Yes. Thank you very much, doctor. And I really love it. And I've started, although I'm a hypnotherapist, now instead of doing an induction, I just go straight through the body.
Yeah.
Yeah. And I really am, and I'm seeing great results. Yeah. Thank you.
Thank you. Thank you. And would you like to say something about the Swati's case? You said that you were there.
Yeah, Swati's case. Because in the level 1, that's what we did, and she just said that, she has pain in her neck. And then you just started asking her questions. She started feeling that some sensations in her body. And then she came up with her whole story of her father passing away and how she was in denial. And within 15 minutes, her neck was back to normal, because she was carrying that pain since last 3 years, and she got healed completely in that 15-20 minutes.
Yes. Thank you.
Yeah, and I was really impressed by that.
Thank you. Thank you very much. Thanks a lot.
You're welcome, doctor.
Rajiv, good evening.
Oh, yeah.
This is Ravi Kiran.
Ravi Kiran. Hi, Ravi Kiran.
We spoke some time back. You were my external examiner during my level 1 teachers training of.
Oh, yeah, Bangalore, Visakhapatnam.
Bangalore. And then after that, I've retired from the Navy, Rear Admiral. Yeah, I've been helping out clients with the hypnotherapy, but I've been getting your messages on WhatsApp. I'm on your mailing list. And it's been, I've been from the results and from the experiences you have been sharing. I actually felt that I could do this and then it would be of great help, but somehow it didn't work out. Your program is starting now in April. I may not be able to join because of other commitments of mine, but certainly I would like to join and
Thank you.
benefit from this and then work together. In fact, we spoke. I thought you could actually come down to Visakhapatnam and speak to some of the students. You wanted me to organize.
I will. We'll figure out.
Yeah.
Yeah.
We will figure out. Thank you very much. It was
Thank you,
nice attending your program.
Thank you.
In fact, this webinar, I have some other books, Body Heals Itself and Creative Visualization and
Yeah.
Biology of Belief, Epigenetics. You all mentioned all that, and I suppose that's a way ahead in future now.
Yes.
Thank you.
Thank you very much.
Excuse me, Mr. Rajiv, sir.
Yeah, I'll do one thing, friends. I'll just complete this thing because there will be some people who would like to know about this. I'll take the questions. Just give me 2 minutes, Pritika. Give me 2 minutes. Yeah.
Thank you.
So this is a core somatic integration, friends, is a body-centered integration therapy. Yeah, in which there are 6 steps which I talked about. One is called acknowledging, tracking, witness sensing, supporting, discharging and integrating. Yeah, I just made a acronym for this. All that we seek, divinity inspires. So acknowledging, tracking, witness sensing, supporting movement, discharge and integrate. And that's where the whole change happens in the people. Yeah. And I teach step by step, how do we acknowledge what is happening, the tracking method, the witness sensing method, and the supporting, when does it happen? And this is where people have been able to also do it with their clients very easily. And even in the first day, first session, first level, first day, people have started taking up healing work with other people. So that is how simple and easy it is, because actually life is very simple. Healing is also very simple. Yes, you got to practice enough so that you have that expertise. But otherwise, it's very, very simple. We don't have to make it convoluted. We don't have to make it so much complicated. and let's work in a way how life functions, easy, smooth, and simple. And if you start doing that, I can guarantee you healthy relationships, healthy body, healthy business, and actually having a life of power, freedom, and peace with ease and grace. So core somatic integration is a body-centered therapy tapping into the innate healing potential by releasing the stress or the traumatic experience. I couldn't talk about trauma and all. I realized that I wouldn't be getting time. Some of the diseases someone was asking, what all we can treat? Migraines, headaches, back pain, ankylosing spondylitis, GERD, irritable bowel disease, leukemia, menstrual problems, PCOS, behavioral problems, overcoming addictions, pain, obesity, relationship conflicts, PTSDs, stress-related problems, depression, anxiety, OCDs, fear, phobias, trauma from death and loss, and many more. And this is what we are doing. Accelerate cures by 50%. Steps to transform disease into natural health. How to have freedom from diseases in learning in 2 days, the 6 steps without any harmful side effects of medicines. Develop self-mastery using self-awareness. Hundreds of counselors, therapists, doctors, psychologists across the world have integrated these modalities in the practice. And also laymen have used it. A lot of people from various MNCs, corporates have used it. So this is what it is. It is 3rd and 4th April. People who want to click this can click this. I'll be putting it on the group also. Early bird discount, it is 14,000 bucks, the fees. Otherwise, the early bird discount for next 2 days, it is rupees 7,000 with a 50% discount. You can pay by paying 500 or by full. And this is my number, 9820800120, and this is my website. You can just type Rajiv Naidu, RAJIV or RAHJIV. You will find it somewhere in the net. Okay, friends ask me. Yeah, Pritika.
Dr. Naidu?
Yeah.
Yeah, these modalities, I don't know why they're sounding very familiar. Either I have attended one of these earlier classes of yours or...
You have done hypnotherapy.
Yeah. How is it different from the clinical hypnotherapy that
It's
the 5
quite
levels?
different because this is a body-centered approach. The approach itself is different. The body-centered approach.
Okay.
Yeah, over there it's mind-centered approach. Here it is body-centered approach. Everything is in the here and now. Like people sitting, open eye therapy, and then people experiencing whatever is happening right now, right here. Yeah, that is
There
why.
was one additional thing that you had conducted that I remember attending, though I don't recollect the name of the class. It was your class, sir.
We'll talk about it. We'll talk about it later, Nandini.
Okay, all right, sir.
I'll talk about that a bit later.
Okay.
Okay, anyone?
Yes.
You want to ask some questions?
Yes, I wanted to ask you.
Yeah, can I see your face, please?
Sorry, I think my Zoom webcam is not operating.
Not a problem. Not a problem. Please go ahead. Please go ahead.
I have a problem in my eye. I have an optic neuritis. But with my willpower, I do. By doing this course, will I be able to cure myself?
I didn't get you. What's your...
In my eyes, I have optic neuritis.
Okay. Neuritis, yeah.
Yeah, like the blood circulation is less in my eyes.
Yeah.
In my left eye and my right eye, I can see, but not that much. Like if I'm tired, then otherwise I'm doing everything myself. I do everything myself.
Yes. So whether it can be cured.
Will I be able to cure myself?
You see, the thing is, I don't know about the names because I don't go by the names of the disease.
No, I'll tell you something. It is like the blood circulation is not coming in my optic nerve.
Pritika, I know that I'm a doctor.
I'm sorry, sir.
No, I'm not saying that. I am saying that it's not the name of the disease, whether it can be cured or no.
Okay.
The healing mechanism remains the same because we are healing the person behind the disease.
Okay.
Are you getting me? So it doesn't matter. Yes. I said cancers, migraines, eye problems. It doesn't matter what it is. It is possible to cure. Why I'm saying I don't go by the name and I don't know also because it's not necessary that all the people who are having variety of diseases or even this kind of autoimmune disorders or anything, they come to me. It's not necessary. But then once they come in, then I can say, okay, I have cured this. Like migraines, I have PCODs, I have thyroids, I have. So all these things I have seen them and helped them. Are we together? But this can also be helped. That is what I can tell you.
Okay, so because I have thyroid also, so like that's why, because on 3rd and 4th there was another course, and you're only on 3rd and 4th, right, sir?
Yes.
From 3 to 8 o'clock.
3 to 8 o'clock.
Oh, but I'll definitely try to join, sir, because I want to just cure myself. I had some problem in my life.
I get it.
Cure myself, so at least I should be, able for my daughter. I have a 14-year-old daughter.
Yes.
Thank you, sir, very much.
You're welcome. Anyone else wants to ask a question? Geeta, you want to ask a question?
Yeah, I am having hearing problem. So I'm using machine also. Can it be cured?